everyone. I hope you're all right. Sorry for the slight delay. We was trying to get a presentation up on the screen, but technology has unfortunately beaten us this morning, so I do apologise for that. So there was a presentation, but instead I'm going to just talk it through. The screen won't let us split it or me share anything, so sorry about that. I hope you're all right. This is definitely the most dressed up I've felt in weeks. I'm not in gym gear for once. So the aim of this webinar today was actually around us sharing with you, I'm sorry, I'm just going to drag my slides on so I can cover things, is over the last few weeks within recruitment, we have seen a few changes. There's obviously going to be some demand that we're expecting over the next few weeks, especially within temporary resourcing and how do we find and fill roles. We've been getting quite a lot of the similar questions from framework users, providers. So we did think it'd be handy to just do a bit of a quick Q&A for half an hour. And if this works, we'll probably look at doing that again, potentially with other PBOs such as ESPO, NEPO, CCS, etc. Just to try and get some information out there as much as we can and as quickly as we can about what we're seeing in the market. The webinar is aimed at public sector organisations. I am aware that we've got a few providers that have decided to log on this morning and that have registered. That's absolutely fine. You're okay as agencies, MSPs to join the call, but a lot of the questions that we go through the Q&As will be aimed and we will prioritise framework users questions over providers. But what we will do at the end of the day is collate all of your questions together and make it into a bit of a quick Q&A, and we'll also be sharing that with other PBOs so that they can share that as well. Just to start with, I just wanted to give you a few key updates as to what we've kind of discussed with quite a lot of people at the minute in the market. And then I'll go into some key messaging and then we'll move straight on to the Q&As if that's all right. There is also a question section in the webinar feature, so feel free to interrogate me, ask me any questions you've got in the market, and I'll do my very best to answer them as much as I can. If there is anything that I'm not 100% sure on, instead of giving you incorrect information, I might take some questions away and provide you with responses through the Q&A document, but I will do my very best to answer everything this morning. So the key updates on the sector is, so all PBOs, YPO included, has sent out quite a bit of communication around the new PPN that went out, I believe it was last week, sorry, the week's mingling into one at the minute, around the payment to suppliers for contingent workers. YPO are supporting that guidance. The guidance is a must for central government departments and is strongly advised for other public sector organisations. But again, it does just depend on your needs. So depending on what area of the public sector you fall in, might be whether that might be able to apply for you or not. So for example, a university might struggle when actually they're fully closed. So they might struggle to follow some of that guidance in some areas, whereas other areas, it might actually be that they can redeploy employees into other areas, etc. So all the kind of the guidance that we're giving to customers is that we're strongly advising to at least consider that guidance or understand the areas that you can at least consider the guidance. So it might be that you can do it for 80% or 90% of the workforce, but just try as much as you can. I think it's about the bigger picture. I think it's kind of some of the things that we've looked at, and I'm sure you're aware of it all. It's around making sure that in the future, whenever normality might be, that there's actually a supply market for us to still utilise for normality, and also just supporting local employees in your local areas, which I'm sure you're all aware of. But yes, that's one of the probably the bigger updates that we've had over the last few weeks. There's also obviously been some amends to the right to work and DBS checks. So those amends are allowing things to go a little bit more digitalised, and they haven't been put in permanently. They are getting reviewed to see how that might work in the future. But as it stands now, while we're in COVID-19, there has been some amends to right to work and DBS checks to allow it to be virtual, and we have spoke to MSPs, agencies around how they're implementing that, how they're working with customers, and actually I think it's going quite smoothly. I think we're all in a digital era. I know my team even alone, we've just been able to literally leave the office, pick up and carry on working, whether that's home working, etc., doing calls via Teams, Skype, whatever that might be. And I think the recruitment world is no different. That's gone very virtual too. So yeah, so we're seeing that that's working really well. there's obviously been a delay in when the amendments to IR35 is going to be implemented. So IR35 will now be moved through to next year. So actually all the changes that you were looking to maybe make to your current situation will be postponed to next year. One of the other key messages I want to get across was that actually all PBO, the 4 big PBOs within particularly local authorities, which is as YPO, NEPO, ESPO and CCS, as in normal world, we're all competitors, we might have competing recruitment frameworks, that's kind of no longer existing right now. We're working as a team and we're having 2 weekly calls, we're working together. I'm working closely with David and Jamie at ESPO, Michael at CCS, Steve at NEPO. The idea is actually, as PBOs, we need to come together. And actually, if we can help you find your recruitment solutions together, that's a much more powerful tool than if we're still looking at competition. And as far as I'm aware, it's going really, really well how we're all working. So that's great. So something that's coming up quite a bit as well is delays in reprocurement. So we're getting asked quite a lot around the extensions and direct awarding on recruitment contracts. We are suggesting that the MSP market is quite busy at the minute, finding temporary workers, etc. And we are talking to different customers and we are seeing people start to make extensions, which is going alongside. So I'm sure you've seen the PPN that was published by government as well last 2 weeks ago now. And that was around actually that it's about going out to the market at the right time, and actually you can utilise Regulation 72 in the procurement regs to look at reasonable extensions. So we are having a lot of conversations with current customers who call off contract end soon, because the priority is getting workers in, not necessarily doing the reprocurement at the minute. So we are starting to see that quite a bit. The other thing I just wanted to give you an update is on the key messages within the sector. So we are seeing managed service providers are and appear to us to be working excellent in this market at the minute. They are adapting their supply chains to suit the different needs. They're working quite heavily with customers. They're talking to customers. They're engaging with local authorities, central government, police and fire, etc. They're having the conversations about what's happening next. And all I can suggest to anybody is keep the communication going. Communication over these next few weeks, to me, is going to be the key to the success if we can get it to be successful with finding workers. There's a lot of skills analysis going, so redeploying staff into certain different areas. So work with your MSPs or your recruitment partners to actually say, where can we move current temporary workers? They will have knowledge, what are their skills, what are their strengths, what are their weaknesses, where do you think we can move them, where they'll be able to still deliver and support us. There's lots of work around the key workers, obviously, and we are getting the similar messaging from all organisations. The key workers, and I'm sure I don't need to go through these, but are your frontline services, health workers, social care teams, customer services, cleaners, porters, your IT teams. IT teams are kind of probably behind the scenes, making sure that we can get everything done that we're getting done. So they're just as important as well. But yeah, so it's kind of the same messaging across everybody, and I'm sure that's pretty much what you all know anyway. We are starting to see less movement of those key workers. So within local authorities, we are seeing that social workers are staying a little bit more within social care teams that they're in. I think it's a bit more security, and it's helping them probably feel less vulnerable during these uncertain times. So we are seeing the less movement, which is really good for the market actually. Pay rates. So pay rates is something that keeps coming up quite a bit at the minute. Should we be allowing huge margins, huge rates to take over? Actually, procurement can still be in the back mind of what you're doing. So the importance of getting those workers is key at the minute, but actually thinking, like, just challenging a little bit maybe when talking to providers. We don't expect that on any current contracts, and we've not had any feedback from any MSP as of now, that anything to do with pay rates is changing. We are seeing obviously the odd fluctuation in some delicate areas, but the majority, agency margins, MSP margins, should not be moving at all. It's, to me, around pay rates is communication. So going back 6 months, if you were struggling to fill a role, one of the key things you'd ask is, why aren't I filling it? What's the demand like? Is it supply and demand that's affecting this fulfillment? And to me, that's no different now. So actually, if you are struggling to find workers, etc., having that conversation with your recruitment partners, your MSPs, your RPO provider, whatever that might be, is just as important now. Then we're starting to see that quite a lot of authorities are starting to develop talent pools, and also talent pools across authorities, particularly in social care and NHS frontline workers. We're seeing that people are building up the type of talent social worker teams, and actually sharing resource is going to be really important over this next few weeks, actually sharing it and understanding actually how do we over the next few weeks maybe share resources, different people peak at different times, etc. So what I'm going to do now is I'm going to move on to the Q&A. I hope that kind of brief update was helpful, but I'm going to move on to the Q&A. So please feel free to raise any questions you'd like in the box that's on your screen, and they'll then come directly through to me, and I'll start going through some of the questions we had. We have already had some that have come through within the last 10-15 minutes while I've been chattering away. So what I'm going to do is I'll start to go through them. I'll then ask any questions. If you've got anything that's in confidence, so you don't feel comfortable asking it on here, my email address is lizzie.grayson@ypo.co.uk, and we can have a off-the-scenes conversation and go through everything. And like I mentioned earlier, all Q&As will be published later today, so you'll get all of the information shortly, fingers crossed. So I'm just going to start pulling through the questions, if that's all right. So what I'm going to do is I'm going to read through a question, and then the next thing for me is I'll then start to respond to them. Is that all right? So one of the first questions that we've got is, so something I've just briefly mentioned, but I'll go into a little bit more detail. My current MSP is due to expire in the next few months. Can I extend beyond my original 4-year call-off? So, as I briefly mentioned earlier, Regulation 72 in the procurement regulations has been pulled out in the recent PPN that was published by government. What I will do is I will attach that PPN as we send these questions out, so you've got supporting evidence to support some of the stuff that we talk about. So actually what we're suggesting is that you need to speak to your own legal teams to make sure that they're happy with that. What that PPN says is that a reasonable amount of time, so if you've got a busy procurement team and your resources are occupied elsewhere and you don't have the time to re-procure right now, is that extensions can be reviewed and looked at. Again, YPO can't advise you legally, but we can say what we suggest, which is speaking to your legal teams about that option and to whether that is an option for you. What we are suggesting is maybe actually put something in place to do the extension for 6 months with an additional 6 months. So it makes sure that you're not just re-procuring it. The recruitment market is still moving, it's still changing. I'm no doubt it's going to change even more over the next few months. So actually you want to make sure that you've not got kind of a delivery model that's not working for you. So what I would say is I wouldn't be expecting to see anybody putting something in place for a long period of time. What we'd be expecting is something with 6 months and maybe another 6 months potentially, to give that flexibility to play around with actually when's the right time to go out to market. Because at the minute, probably getting your stakeholders, the head of social care, and what they want in temporary recruitment for the next 4 years is not going to be priority. So getting them involved in understanding and spec writing is probably going to be a bit of a challenge. So yeah, so what we're suggesting is look at the PPN, Regulation 72 has been pulled out, speak to your legal teams and do short, reasonable extensions where relevant. I hope that's helpful. So the next question is, I'm expecting my current MSP will be struggling over the next few weeks to fulfill roles in social care. Do you have any suggestions? So one thing I would say is that we're seeing that managed service providers, we're talking to them quite a lot at the minute. And what we are seeing is that they are reviewing their supply chains depending on what they think is the fluctuation after communicating with yourselves. And quite obvious probably for some of us that social care is probably going to be key and high on the agenda. So 1 second, sorry, I do apologise. My screen's flashing away, so sorry. I was just checking that all of you could definitely hear. So yeah, so around struggling with adult social care, they are looking at how they can develop supply chains. They are looking at growing supply chains. They are speaking quite proactively. Something that we're going to be speaking heavily to MSP providers and starting to talk to customers about, and this will be in partnership with ESPO heavily within the local authority market and NEPO, is actually within adult social care, how do we start to try and support people that might be peaking at different times? So from the point of view is, what are you actually speaking to your neighbouring councils, your neighbouring authorities? We are all aware that social care in general, qualified social workers, is hard to fulfil in this country anyway. So it's going to get harder, is the guess. So actually what we're going to try and do is how we can look at messaging, and ESPO will probably be leading on quite a lot of that around messaging, etc., around how that joint working and actually partnering with local or neighbouring boroughs and neighbouring councils to actually say, actually we might be looking at peaking here, you're looking at peaking in 3 days after us. How do we fulfil and share social workers? I know we're also kind of, we know who our social workers are, we protective of them because they give us good quality candidates, but some of the stuff might be actually MSPs will need to talk to each other as well. So as much as your MSPs are trying to develop supply chains, it's about developing the better supply chains for the next few weeks. The supply chains in place are great for now, but there might be some other agencies that normally wouldn't go on an MSP that are willing to during these times. So that's kind of the market I'm talking about. Talking and speaking to your neighbouring boroughs. And like I said, there is going to be some guidance that I think probably ESPO is probably going to lead on, and we'll probably work with them on and pushing that out. Because Jamie's been speaking quite a bit about that at ESPO around some of his communication he's doing. But also it might be about thinking a little bit differently. So we have got other frameworks that might support MSPs if they are struggling. So I think it's around, your MSP should 100% be the first port of call. But if there is going to be times where we're struggling, us, ESPO, NEPO, CCS are looking at our other frameworks, our other providers, and saying, right, what's your demand like? What's going to be a fulfillment? If somebody come to you and needed 20 social workers to start tomorrow, how likely are you be able to fulfill? We're having those conversations. So my best thing would be is, if you're starting to see that, is pick up the phone to your PBOs. We can start to point you, we can be the ones that kind of pull you into other organisations. So I hope that helps. I am aware that adult social care and social care in general is going to be a difficult thing over the next few weeks, but again, it's just communication, I think, is going to be the key. So the next question that we've had to come through is, have you had a discussion with MSPs about the quality of candidates? We don't want to waste time. Yeah, so clearly nobody wants to waste any time at the minute. So I think that conversation needs to be had by us and you. So as their customer, I think it's quite apparent that sometimes in this market, quality of candidates can vary. Some agencies on MSPs can sometimes appear to send through candidates that don't always match roles. And there is a lot going through these MSPs, so it's hard to always track it. I think what's really important is, and we will be speaking to MSPs about this in the near future, is actually in the next few days while we're speaking to MSPs, probably you as well, is saying, I don't want anybody that is not exactly matching my candidate spec unless they have got skills that can be transferred. So I think that's two aspects. Is it's not necessarily this, we want good quality candidates, but if you can't get them, maybe the only other candidates I want to see are people with the right skill set to match my demand. And I think that's quite important as well. But yeah, we will be having more conversations with MSPs about the quality of candidates. You don't want 20 candidates filled through if only 4 of them actually meet your spec. You actually just want those 4 right here, right now, right, what can we do with them and where can we place them? So yeah, we will be having those conversations, and we suggest you do as well. So the next question is, sometimes roles are held by our MSP. We have suggested this doesn't happen throughout COVID-19. Can you discuss it with providers? So yeah, so whether roles are being held as such, so that might be in a neutral vendor model, that they're held at tiers, tier 1, tier 2, or it might be if you've got a master vendor or a hybrid, potentially roles are getting held internally before being released. YPO are looking at sending out a notification to MSP providers to suggest that there is a much shorter time period for roles being held. But on the reverse of that, I also think MSP providers know what they're aiming to deliver for right now. MSP providers want to get you candidates, good candidates, in post. It matters to them as much as anything. How they behave and how they react through times like COVID-19 represents them as a company, in my view. And I think they know that. So the more appropriate they behave during these times, which is to me not holding roles if they know they can't fulfill it. But a bit of trust has got to be given on the MSP providers too. So we've got to trust MSP providers. If they are thinking they're holding a group of workers, it's got to be that they are thinking that they can fulfill them. I don't expect to see much over the next few weeks and months where MSP providers should be holding roles at any point where they know up front they can't fulfill them, if that makes sense. So yeah, but we will be having that conversation with providers. Are all providers still able to continue supplying roles? Are we keeping in touch with them? So, are we keeping in touch with them? Yes, is the simplest answer. And I know this is the same for ESPO, NEPO, CCS. We are all heavily engaged with our providers at the minute. One of the things that we're trying to understand is how they're predicting the next few weeks, how they're reviewing it, how they're talking to you as organisations. We have had no feedback as of yet, but I am aware that we're just at the beginning of peak going in, potentially on COVID-19. So what I am expecting is that the next few weeks, we are expecting providers to be feeding back to us. So what we're doing on a weekly basis, that might be upped. So as we see things move, that might change. Actually, if there is starting to be shortages, we want MSPs to be starting to advise us on that. We want to know, right, we're starting to struggle in this region of the country to fulfill this type of category. So we're starting to collect that data. That's the data that we want to then be able to share with you. So what you might see over the next few weeks is us collating data from providers, sharing it with you, but also trying to collate anything from you to share with providers. The only reason that any PBO at the minute, us ESPO included, everybody, will be asking for things is because we're trying to help. That is the only reason. We're trying to be the person that can move that information around so that we can kind of be the linchpin that pulls all of that together. But as it stands as now, all our MSPs are providing majority of the roles, other than general hard to fill that was prior to COVID-19. There's still going to be some of those struggles. But in the main, nothing because of COVID-19 have we seen 100% hasn't been able to be delivered as of yet. But again, I believe that's going to be massively changing over the next few days and weeks, months. So yeah, we will be keeping in contact with them and feeding that back to you as much as we can. So the next one, should I carry on with my reprocurement during this time or hold things until it calms? So some of that probably goes back to a question earlier. Should you carry on with your reprocurement? We're not suggesting people stop. So I think some of the spec writing depends where you are in the process, is my honest answer. So if you're at the stage where you've got your bids back in and you're evaluating and your implementation, actually, that probably can continue. However, would you want to change providers during this time, in all honesty? So it's a matter of, it depends on your situation, is my honest view. And I think you should be talking to your PBOs. So go and communicate with your PBOs and we'll probably give you an honest view. So we've had a group collaboration of around about 5 authorities that came to us, asked us our opinion about 2 weeks ago. They were at the they've done customer engagement, they've done provider engagement, the spec writing. But actually, we've had our honest conversation with them and said, do you want to publish a tender right now? Because actually we are starting to see that the market's priorities might be elsewhere because they're trying to help you on your everyday delivery opposed to strategy delivery, if that makes sense. So again, I would just say speak to PBOs. They'll be able to lean you, and so speak to me at YPO, speak to Lucy at YPO, speak to David, Jamie at ESPO, Steve at NEPO, Michael at CCS, whoever your normal contact is, go to them, use them, and have that honest conversation about what do you think's best at this time, depending on where you are in the situation. Should we be accepting higher rates for workers throughout COVID-19? So briefly mentioned this earlier, and it has come up, so we've had quite a lot of customers asking us that. Agency fees and MSPs shouldn't be changing. They shouldn't be moving. What we're expecting is that some agencies are getting onboarded by MSP providers right now. So they are being onboarded and they might be trying to demand higher rates. That is a conversation that probably does need to happen with agencies around why, or what are they looking for, what are they adding value to, and etc. But workers, again, it's going to be about that marketplace at that time. So if in London, your rates might change differently to the Manchester region. And I think a lot of it will be communicating, wherever possible, try to keep to the rates that you've procured to. That's what we're suggesting. Talk to us about what you're looking at doing. Speak to us. We'll try and help as much as we can. But it's balancing that priority, and I'm sure you all know that getting the individual in against the rates, but actually rates should be manageable still. However, what we would say is we are definitely seeing some naughty practices. So we are seeing that there is some agencies in some key worker areas that are trying to get through the back door of local authorities and are actually coming in at much higher agency fees, etc. Because it's all about supply and demand. YPO will be trying, and I'm sure other PBOs will be, to knuckle down that behaviour. It's unacceptable behaviour in my view. And these are times of working together, pulling together, and actually trying to not work with local authorities or trying to get higher rates out of them is just not the way forward during COVID-19. And we'll be working with MSPs to try and make that stop wherever we can. It's likely that we see some inflation on some areas, depending on what that is. But again, communicate with your PBOs, communicate with your MSPs as to whether that's realistic or not, depending on what's happening with the market. Just as much as it's hard for you to predict some of this, it is hard for us. So it's about us working with you to say that's just ridiculous, or actually market demand is seeing this, etc. And I'm saying that your gut will probably give you where that fits. You probably have a gut instinct as to how that is. I am aware of time, so we are running a little bit over. Sorry, that's because I can talk forever. So what I will do is I'm just going to carry on a few more, so we might run about 5 minutes over, but I will publish all the questions that we've received so that you can actually see all of them. So I hope that helps. So I'll just do a few more for you in the next 5 minutes, if that's all right. So how are you and ESPA working together? We are using both of your frameworks. Okay, so it's not just me and ESPO and YPO and ESPO, it's the bigger picture. So the 4 PBOs I've mentioned already on the call, and we're all working together. We have 2 weekly meetings. So every Tuesday at 1:30 and every Thursday at 1:30, we all dial in, we give an update on the sector. We agreed the way forward around the supply, the payment of temporary workers. We're agreeing the messaging that we're putting out to go forward. And also, if you use both frameworks, I'd say openly talk to any of us, is my honest view. We're just aiming to try and support you as much as we can. I'm guessing that if you use one of ours, you're probably likely to use mine for MSP or ESPO's for MSP, and kind of LGRP or strategic HR the other way around, if that makes sense. But just talk to us. We've also each got a document that tells us about each other's frameworks. So I've got a bit more information I normally would have on ESPO's and vice versa. So we should be able to help you a little bit more as well. Sorry, I'm just trying to scroll through to make sure that we've got kind of some of the key questions pulled through. So if I just need a team of social workers, anything I can help with. So this goes back to your MSP fulfillment probably. Actually, within MSP fulfillment, if you are really struggling, there are other routes to bring in teams of social workers, and we are starting to get asked that question, and I'm sure other PBOs are too. So if you're looking at that, as is actually still is on managing temporary and permanent recruitment, it's lot 11. We would look at for you how you can work. So we've got, I think it's 22 providers on that framework that will be able to develop you pools of talent, if that makes sense. And there is other options obviously out there. We are working, so what we've done is we've worked with all the providers on that lot to say, right, what are your top 5 specialisms? So actually you don't have to waste your time going to all providers. Right, if you want social care, these are your top providers that can deliver a team of social workers. if you're wanting cleaning services, these are the top providers that can deliver your cleaning services. IT, these are the ones. So we've done a lot of that background work now, so that actually you only need to go to providers that can help you as and when you need it. So yeah, it is expected. So as much as we are pushing for MSP delivery and fulfillment through MSPs, it is expected that during over the next few weeks, we are likely to see that there is going to be demand on other frameworks for specialist areas. And I think that's the same across all of us. We are expecting that to come. So we've prepared for it, is kind of what I'm saying. So are councils following the guidance around the payment of temporary workers? So yes, is the simple answer. Spoke just yesterday specifically about councils to ESPO as well. We spoke to quite a few of our London boroughs that use our framework. ESPO have been doing the same with theirs. Talked to our Manchester customers, Yorkshire customers around what they're doing. Majority of public sector appear to be following the guidance. I can't say 100% all. So what we are seeing is that some councils are saying, right, I'm paying 100% pay. Actually, some have dropped it to the 80%. Some have initially started with 100% pay and looking to potentially drop to 8% over the next coming weeks. The one thing I would say is we are talking as well with customers and councils around, it's about when there was their assignment. So a lot of the question we keep getting asked is, when do we have to stop paying them? So what I would say is that it depends on when your assignment was. So if your assignment was to end next Friday, technically you would only have to pay them for next Friday. But what we're saying is, it would be good if councils could feed that back into MSPs, and MSPs should be working on this proactively as well, is to say, it's unlikely that these assignments are going to continue past their assignment dates if there is nothing for them to do. But one of the things I would also say is redeployment of these temporary workers has been phenomenal in some of these councils. Councils are redeploying their permanent staff effectively to service frontline services. It's been done brilliantly. They're also then looking at these temporary workers and saying, right, where do we redeploy them to suit? YPO as an organisation, we are no different to you, so we've been looking at that internally. So we have had some temporary workers that we no longer technically need for frontline delivery, but what we've actually done is looked at where can we redeploy them, which ones can we not redeploy, which ones can we continue paying in line with the guidance, etc. So yeah, I think redeployment's the key thing, but also communicating with your MSP if you're not going to no longer pay them past the end of their assignment, so that they can start to be trying to find other work using their skill set, etc. So next question, I'll just do two more if that's all right. We are speaking with our MSP provider about developing stronger supply chains in some key areas, but they don't seem to be reacting to it. So if you feel like your MSP provider is not reacting to delivering and developing stronger supply chains or more tiered supply chains, speak to us, is my honest view. Speak to us and be honest with your MSP provider. Your MSP provider is there to deliver and support you as much as they can at the minute. And I'm sure they already are doing. We are talking to them a lot, and to me, it appears that a lot of the providers are doing a lot of extra things to try and support you as much as they can. If you feel like they're not reacting in some areas, then let us know, let ESPO know, whoever your PBO is. If you've done your own framework, that's absolutely fine too. We can speak to them. The likelihood is that you're still probably going to be with one of our providers. We'll still speak to them on your behalf, even though you're not using our framework. That's irrelevant to us right now. So what I would say is, let us know. Because I'd be really interested in understanding if some of them aren't, they should be. So we are expecting that providers have got backup plans. So they might have to be talking to social care agencies they would not talk to. So we all know that there's the liquids of the world all on the supply chains, etc. Who else? Where's your specialist roles? All of these should be getting considered. Or there should at least be an analysis piece behind every region of who the backup plan is. As far as I'm aware, MSPs are doing that. But please let us know, because obviously if she's to raise this question, it means that there's some worries. So let us know, please, because we want to help you in any of that. So our procurement team is struggling to resource things at the minute. Can YPO or others help? So what I would say is, generally us as PBOs do try and help as much as we can. What I have said already in YPO is, so I've already gone to my management and said I may need extra resource over the next few weeks. What YPO is willing to do is basically take a conversation and turn it into a procurement for you. You will have to still review it because legally it's you that's doing that. But actually, on the back of anything that you communicate with us, we should be able to, so if you come turn around to us and say, right, I need by next Friday a team of 30 social workers. I've already spoke to this agency, I need a direct award running. We will pretty much complete you the call off, complete you the direct award order form, sort it all out for you and give it for you to review. So that's what we're trying to do, is save time. So the time it's taken you might take you half an hour to complete that document. We're trying to give you that half an hour back so that we can actually try and help as much as we can behind the scenes. We've got Lucy Ebony that proactively work on that, but I've got a wider team that know recruitment too and can be pulled into it. So yeah, so we are trying, and I'm sure ESPO, NEPO and CCS will be going the extra mile as well to help you as much as they can. So yeah, just ask is kind of my honest view. Right, so I'm just going to go for one more question. Is there a list of specialisms that providers can offer on your frameworks? So yeah, as I mentioned briefly earlier, actually what we've done is we've developed a kind of overview document. It's going to be getting put onto our website this week. What it will tell you is that if you can't fulfill through your MSP, these are the other alternatives, these are the other providers. If you're a local authority or housing association, police organisation, this is where to go. These are the ones for you, because not every provider will deliver to every sector. But these are providers for you, and depending on what roles you are, that's when I would say, drop us an email, pick up the phone to us and say, right, I want to look at, I'm a local authority, I need social care team delivered, this is what I want to do, who's my providers, who's my options, how do I get going on about it? So yeah, so we've done quite a lot of the specialisms in the background as well. But yeah, so what I will do is I'll pull all the questions that we've had today together and create into a Q&A document for you. We'll publish that on our website. We'll also email it out to anybody who's registered. We're probably going to send it out to all the other PBOs and any other kind of customers that we generally speak to. But yeah, if you've got any other questions, feel free to email me directly, or actually just email into our team inbox, which is hrsolutions@ypo.co.uk. I'd just like to thank you all for your time this morning. And yeah, I hope it's been helpful. So yeah, thank you. Thank you for your help this morning and stay safe. Thank you. Bye.